Good afternoon. My name is Rhonda McLaren, and I'm here today to talk about living with eczema in today's society. Eczema, also known as atopic dermatitis, is an inflammatory skin condition that causes dry, itchy red patches and can be very painful. There are many triggers and treatments for eczema, and depending on the individual and the severity level. According to the Mayo Clinic and the National Eczema Association, there's not an exact cause of eczema. Instead, it's thought to believe that genetics and faulty skin barriers play a role in its existence. A few of the triggers listed by the Mayo Clinic and the National Eczema Association is a big one is allergies. It can be pets, dust, mold, seasonal allergies, food. If their fruit juices can get into the skin and cause cracks and cause a flare-up. Also irritants such as shampoo, laundry detergents, fabric softeners, anything with a scent can cause your skin to flare up. Also the heat. If it's hot outside, it can cause you to sweat, which increases the chances of a flare up on the skin. And also low and high humidity can cause it, along with a woman, her hormones, if they increase or decrease, can cause a flare up. So as you can see, there are many triggers that can affect the eczema. The best treatment is prevention. Avoid the triggers that cause the flare ups. So if you know that dust causes it, it's a good idea not to have carpet in the house, because carpet tends to trap the dust and can cause it to flare up. Avoid activities that cause you to sweat a lot, and try to avoid the heat if possible. Also, other treatments on the medical side of it would be steroid creams, antibiotics for the skin infections, immunotherapy for more of the severe cases. Sometimes the doctor will give you medicine to suppress the immune system to keep it from attacking itself, which will cause the flare-up. Also, if you have a nickel allergy, that's very common among people with eczema, and they actually have a test kit where you can test jewelry or watches, eyeglasses to make sure that they're nickel-free. So that's some of the treatments. Also, taking bleach baths help prevent skin infections. And for the more severe cases, wet wraps, which mean you apply a lot of the steroid cream and then wrap it in wet bandages. And those are for more of the acute flare-ups that are pretty bad. In eczema, it's thought that if you can control the itch, you can control some of the infections that come along with it. Now, eczema does not only affect the skin, but it also affects your mind. People with eczema experience some psychological effects, sleep deprivation because of the uncontrollable itch at night. They deal with anxiety, and some with depression as they get older. They just want to be like everyone else, and that can be difficult sometimes when your skin is broke out or it's really red or you have infections. People tend to look at you differently. So my goal is just to bring awareness to the skin condition, and just think that, encourage people to have a care team that treats your whole mind and body, not just the skin. Because it's very important to treat your psychological side of it. And it's not contagious. Someone may look at you and think that you have some contagious skin disease, but you don't. It's just a skin condition. And people just want to be accepted for who they are and not treated differently. So I would just recommend that if you have eczema, you're not alone. There are over 30 million Americans that have eczema, and more throughout the world. So you're not alone, not at all. So depression, anxiety, sleep deprivation, the most important thing is prevention. that helps a lot. Learn how to meditate to deal with the stress, and just know that you're not alone.